Board. Good evening, everyone. My name is Noah with Project Lyme, and I have Dr. Bill Rawls with us this evening presenting on dormant microbes causing chronic illness. A brief synopsis of what you can expect from this event before I turn it over to Dr. Rawls. The number of patients that we see experiencing chronic illness has really grown over the past decade, but many people may not know what or why they're experiencing these chronic symptoms. With Lyme and tick-borne disease, as many of you probably already know, symptoms may not develop until months or years after infection, as a spirochete can invade immune response and remain dormant in human hosts for long periods. In long-standing or persistent Lyme disease, bacterial spirochetes may harbor inside major organs, including the heart or brain, where they can continue to wreak havoc over time. Dr. Bill Rawls will be presenting this evening on what he believes this and other dormant microbes may be the root cause of many of these chronic illnesses. He's joining us tonight to further discuss how dormant microbes can react and create chronic symptoms, as well as how he addresses it in his patient population. So, Dr. Rawls, thank you again for joining us this evening. I'm going to go ahead and turn it over to you to get started on your presentation.
All right. Thank you. Thank you, Noah, and welcome, everyone. This is an interesting topic and one that I have been digging into for a number of years. I am a chronic Lyme sufferer. I started my journey 20 years ago. Fortunately, over about a 5-year period, was able to regain my health completely. But I've been working with chronic Lyme patients and just really digging into the research of what this thing is and how we can best treat it. And this particular concept, I think, is one of the really important keys that we should be paying attention to, that explains a lot about not only chronic Lyme disease, but potentially a lot of other, if not most, chronic illnesses. So it's definitely an interesting topic. I hope it stimulates a lot of conversation. So if you find this interesting, let me know. It's really valuable. I'm going to start things off with a case, except no, it's not letting me advance. I think you may have to turn that over to me.
I've had the situation where you'll need to turn off share.
There we go.
Yep, perfect.
Got it. Okay, right. So we're going to start out with a case study. And this is, this isn't like past 2 or 3 or 5 years. Some of the evidence goes back 20 years. This was a case from 2004. 38-year-old healthy female who was a runner and fell and destroyed the cartilage in one of her knees, or half the cartilage. At that time, she was not symptomatic. They decided to do what's called a chondrocyte transplantation. Now they're doing stem cells, but at that point they were doing chondrocytes. And basically what they do is they get a piece of the healthy cartilage, pull that out, grow the chondrocytes, and embed those grown chondrocytes into a matrix and put them back into the joint to regrow, and then had some great success with it. So this was something that was becoming a routine at the time. So this particular patient, they decided to do that. They pulled the cartilage out, they extracted the chondrocytes, they grew more chondrocytes, put it back into the knee, and within 5 weeks, her knee was hot, red, inflamed, and there was obviously an infection and an issue. They drew fluid off of the knee and did some cultures. They were able to, by PCR and growing it out, were able to find Borrelia in the culture. What's significant in her history is that she had a tick bite with a EM rash about 15 years prior to this. She was completely asymptomatic all of that time. And there's no mention in the study of her being treated with antibiotics. Whether that's significant or not, it's hard to really know. But what is significant is this patient was exposed to Borrelia, ended up with it in her tissues, did not have symptoms for 15 years. They stressed her tissues, they stressed her cells. The Borrelia reactivated, grew out, and destroyed her cartilage. So it is a case that the conclusion in the study was this was present for 15 years, and I would say in a dormant state, and then reactivated when those cells were stressed. Really interesting. So when we talk about microorganisms, what are we talking about? It's generally thought of as a single-celled micro living organism, mostly bacteria, protozoa, and then there's single-cell fungi. We also fit viruses into that category. They're not technically cells, but they still can act like bacteria and everything else when they enter cells. So, microbe characteristics. The sole purpose of any microbe is to make more microbes. That's what they do. To replicate, they need nutrients and resources. And what's really significant is, unlike our cells that have a restricted growth pattern, you can only fit so many cells in a heart or a lung or a liver. Bacteria have an unrestricted growth pattern. They grow as long as food is present and conditions are right. So they grow at the expense of all life around them. So that's really important to recognize that this thing will grow. All bacteria will grow as long as conditions are right. But conditions aren't always right. So bacteria, viruses, protozoa, yeast all have a survival mechanism called dormancy, a state of quiescence. And if you look at all the microbe mass of all of the microbes on Earth at any given time, 60% of them are dormant. So dormancy offers a way for microbes to just wait it out until conditions are favorable. And this concept of microbe dormancy opens up a window of understanding for conditions like chronic Lyme disease. So we have a complex relationship with microbes. The microbes we interact with are host dependent. They get their nutrients and resources from a living host. And that's different from bacteria that might live in the soil or other places. Now, all bacteria need to live off of organic matter. All living things are food for something else. So us being a host for microbes, we're their food source. We supply the food. That's really important to recognize. They can't live without us. They have to get the food from us. So the highest concentration of bacteria in the body is in the large intestine, where there's a large concentration of organic matter, stuff that was previously living. And I call this freely available food. So the bacteria can get to it, they can have it as long as there's enough of it present, they keep growing. So the limiting factor is the amount of food that's present in our gut, which is really important for us to keep things moving through, because if things get backed up, that's when things start overgrowing and causing a lot of problems. So when you look at the microbes on our skin and other places, the concentration is much lower because there's not as much food. Our skin bacteria survive off of oils that we secrete to lubricate the skin. But the food material that they find in the gut and oils on the surface of skin aren't the only food in the body. Any organic matter is a food source for bacteria and other microbes, and that includes carbohydrates, fats, all the organic molecules that our cells and connective tissue are made of. In other words, in a way, we are the food. But that food I consider protected food. You know, we don't give that food up easily, of course. So when we talk about a pathogen, the difference between a microbe that's just hanging around and one that we define as a pathogen is that a pathogen is an invasive microbe that does harm by consuming and destroying the cells and tissues that make up our body. So to protect that food source, our tissues, our cells, we have to maintain an elaborate defense system. And everybody thinks about the immune system, but that's just one level of defense. We actually have 4 levels of defense against microbes. The first, possibly the most important, is physical barriers. Our skin is a barrier that keeps microbes out and moisture in. The lining of our gut keeps food material in and microbes confined. So all of all of the microbes that inhabit our body, we like to keep them outside those barriers or contained in some way because they are potentially threat to us. If they get inside, if you damage your gut, if you rupture your gut, that spills bacteria, and that means your food, that barrier is gone, and you become a food source pretty quickly. Those physical barriers aren't nearly as secure as you might hope. Things are constantly trickling across. In fact, while we're talking right now, bacteria are trickling across our skin, our sinuses, our gut, into our bloodstream. So they're constantly finding ways to get across. And they're constantly looking for weak spots so they can get in. I think a lot of skin reactions are microbes breaking through that weakened barrier. Ulcers in the stomach are microbes like H. pylori invading a barrier that's been weakened by some kind of stress. They're all opportunist. So an infection is just a pathogen breaking through those barriers to get to the bloodstream, to get to our cells and tissues. Typically, we define an infection by the way it enters the body. Respiratory infections, colds and flus, and nasal infections, intestinal infections, skin infections, genital, sexually transmitted diseases, and of course, insect bites, mosquito bites, tick bites, all kinds of different insects. They all want exactly the same thing. So the symptoms we have as they're entering the barrier are just one part of that. SARS virus, influenza, cold viruses, what they really want is to break through those barriers and get to our bloodstream. And when we get a tick bite, oh, wow, does that work great for the microbes because they don't have to fight to get through that barrier. The tick injects them right across the barrier and right directly into the bloodstream. And so a lot of microbes really like that tick route. The bloodstream is the highway to all the cells and tissues in the body. Our joints, brain, muscles, skin, are everywhere. So they all want that. To get to the bloodstream is the holy grail. That's where they're headed. So our immune system is a backup plan. It's really important, and we have border guards placed all across those barriers and things circulating in our tissues and our bloodstream all the time. The infantry of the immune system, our white blood cells, are constantly patrolling, looking out for things that have crossed across. No matter whether that's a trickle or an infection with an outside invader, there they are waiting. So factors that influence the severity of infection include the load of microbes. So if you get a pretty light load, you might have lesser of an infection. The state of the host health. If you're not well, if your cells aren't well, you're more vulnerable. Multiple microbes, co-infections. We know this happens a lot more than we realized. It happens with influenza. They documented it with COVID. People that had more severe illness with COVID tended to have other microbes that they were infected with at the same time. And the last one, the big one, is virulence, the potential for a microbe to cause symptomatic illness. So that is a factor of whether we have built-in immunity or not, whether our great ancestors were exposed. So if our great ancestors were exposed to a microbe over and over and over again, we have some built-in immunity, even if we've never been exposed to that microbe. So Ebola is really bad because humans have never been exposed to it. We have no built-in immunity. When it hits the bloodstream, it ravages cells throughout the body. So that built-in immunity is really important. When you look at tick-borne microbes, they're way down on the list. So the more common something has been through time, the more apt we are to have built-in immunity. That surprises me, surprises some people, but I consider most of the tick-borne pathogens to be low-grade pathogens. And the evidence of that is they typically don't cause severe acute illness. In fact, I found that a lot of people, most people, don't get very many symptoms at all after a tick bite carrying Borrelia or one of the many other microbes that ticks can carry. But they can get into our system. And so think about it. Ticks have been biting humans since the beginning of humans, and Borrelia is 60 million years old. It's been around a long time. Ticks have been around a long time. We've had a lot of our exposure. All of our ancestors were bitten by ticks and a lot of other things. They lived in an environment with constant insect bites. So we have built-in immunity. Our immune system does a pretty good job of mopping things up when things invade our system. And that is true of Borrelia too. It recognizes Borrelia as soon as it makes an appearance. But even if symptoms are mild or not existent, some microbes, some bacteria can slip past the immune system's defenses. And there's a lot of evidence in the scientific literature that this happens, even in asymptomatic individuals. So when they do, they invade cells. Cells are the food, but cells are also protection from the immune system. So it is an environment where they can get protection. So intracellular pathogens, it's really important to recognize that all of these things have the ability to invade cells. And that's true of Borrelia, but all the tick-borne microbes. So everything we're talking about. So Borrelia is considered a facultative intracellular bacteria. In other words, it's perfectly happy to invade cartilage and reproduce outside of cells, but it can invade cells and live very comfortably in that environment too. And the surprise is a lot of things that we thought were extracellular, like streptococcus and even staphylococcus, had the ability to penetrate and survive inside cells. So this is a lot more common than we realize. Fortunately, our cells are not defenseless. Our third level of defense, by a process known as autophagy. This autophagy is how cells rebuild themselves, but interestingly, it's also how cells expel or destroy invading microbes. And this is an interesting part of our defenses that I think goes unrecognized, that our cells, all the cells of our body have this defense mechanisms. So if our cells are healthy, using that process of autophagy, they can expel or destroy microbes. If our cells are weak or damaged, we've had bad health habits and we've had a lot of stress in our life and our cells are weakened, that gives the microbes an upper hand and they can actually invade the cells, destroy the cells, use it as a food source, and then come out and start invading other cells. But they have one more trick up their sleeve. And this has been documented for so many different kinds of bacteria. Recently, I found a study that documented it for streptococcus that explains why kids get pandas. Microbes can become dormant inside cells, wall themselves off, hang out there, and they can stay there for a very long time. So dormancy, they're not dead, they're not alive, but they're capable of being reactivated at a later time. Our cells keep right on working like they weren't even there. So the science is suggesting that this idea of microbes becoming dormant inside cells occurs at a much higher rate than anyone could have ever imagined. Now think about all the opportunities that microbes have had to enter your body during your lifetime, from the time you started putting stuff in your mouth when you were a kid, to hamster bites, to cat scratches, mosquito bites, and who hasn't been bitten by some kind of insect. Every time this happens, whether you had symptoms or not, microbes had a potential to enter your body and become dormant inside your cells. And many of them may still be dormant in your tissues. But it's not just Borrelia we're talking about. I mean, this is a small list. And the studies that I'm looking at are finding things that I've never even heard of that are possible. So this is a lot of different kinds of microbes, and many of them cause symptoms that are very similar to chronic Lyme disease. And they all are intracellular. They can all go dormant. We're looking at a lot of possibilities. So researchers are beginning to refer to this as the dormant blood and tissue microbiome. And when you really start to understand what's going on here, it explains a lot about chronic illness. So when you look at this thing, there are lots of studies. This is just a few that I peppered out there, but there are many, many studies that are starting to document this. Interestingly, finding a spectrum of bacteria that are dormant inside the red blood cells of healthy volunteers. That's really fascinating. And that isn't one study, that's like a half a dozen studies. This latest one was in reaction to criticism that, well, it could be contamination. They did an unbelievable job ruling out that possibility and had exactly the same results. And it wasn't just microbes from the outside, it was microbes from the gut and from the skin and other places in the body. So it's really fascinating when you start digging into this. So if you stay healthy, specifically, if your cells stay healthy, you won't hear from them. It won't be a problem. But if your cells are weakened by chronic stress, poor diet, sedentary lifestyle, not getting sleep, exposure to toxic substances or mold, sometimes a new infection, and the aging process puts us at more risk. Yeah, it's like a time bomb hidden in your tissues. And that chronic cellular stress is the fuse that sets it off. So as more cells are weakened and more microbes emerge, your internal state shifts from a state of cellular health and dormant microbes to microbe growth, with microbes being reactivating, invading tissues, and basically turning your tissues into a food supply. The spectrum of symptoms is defined by the cells being affected. So because we have exposure to a lot of different kinds of microbes, there's a wide range of symptoms that are possible, not only in chronic Lyme disease, but also any chronic illness. So the type of cell being affected and how it's being affected defines how that illness is going to manifest. So when you look at the overlap in symptoms of all of these different illnesses, and this is just a few examples, you start to see a lot of commonality there. So when you look at solutions for this problem, conventional antibiotics just aren't a practical solution because long-term therapy with antibiotics disrupts your fourth level of microbe defense, and that's your normal flora. So our normal flora are really important for keeping us healthy because we all have pathogens hanging out in our gut and on our skin and other places in those reservoirs of microbes. And we depend on our normal flora to keep them in check. So our normal flora are bacteria that we have a symbiotic relationship with that secrete substances that suppress growth of pathogens. And that's really important. Now, they're not doing it because they're our friends. They're doing it because they want all the food and they want to cut out the competition. And that's been going on long enough that we have this cozy relationship with them. But taking antibiotics, when you take an antibiotic is designed for fast-growing bacteria. So for something like a pneumococcal pneumonia, that is turning over, it's doubling every 20 to 30 minutes, antibiotics are the right solution. Now, if you take an antibiotic, you're hitting your normal flora, but you're also creating bacterial resistance and pathogens. So antibiotic resistance starts occurring within 10 days of taking an antibiotic. And that's about the time you have before you really start seriously disrupting your normal flora and allowing an emergence of different kinds of pathogens. So for fast-growing bacteria, you can kill those pretty fast. And so it's not such an insult. But long-term antibiotics, you have that problem ongoing. So that becomes a big issue. So look at Borrelia. Borrelia, the doubling time, 12 hours. So it's a pretty slow growing bacteria because it's a lower grade pathogen. It has a lot more things that slow its growth down. And so antibiotics just don't work quite as well. When I looked at solutions, I found that herbs, particularly herbs with antimicrobial properties, were a solution that very specifically fits the problem. Why? Key herbal benefits. They suppress these intracellular pathogens. They do a very good job of being in your system and being suppressive. It keeps these intracellular pathogens from emerging, and when they emerge, it just suppresses their growth. But herbs do a whole lot more. They also protect our cells from free radicals, toxic substances, radiation, and a lot of other factors. If you were going to pick something that would promote cellular health, you can't get a better choice than herbs. But something that's really fascinating is the herbs don't disrupt normal flora with long-term use. They also modulate immune system functions and restore hormonal homeostasis. So taking an herb is doing a lot. It's really interesting. I actually found a study that they documented that herbal phytochemicals were able to suppress pathogens without disrupting normal flora. Really fascinating. So back in 2020, Johns Hopkins did a series of studies, or researchers at Johns Hopkins, they looked at some of our top herbs that we have been using for Lyme disease, for Borrelia, did a test tube study and found that these herbs were able to suppress Borrelia. Now, this is in a test tube outside the living system, so it was direct killing, not influence on the immune system. These herbs actually outperform doxycycline and one of the cephalosporins for being able to kill Borrelia. But some of those same researchers did Babesia, and they found many of these same herbs got that one too, better than the drugs. And Bartonella too. Just shows the wide range that we have with herbs. And they have some antiviral properties that we've seen for influenza, for SARS virus that causes COVID, so for quite a number of other things. So this foundational core of herbs has been around for a while, and it has been found to be really influential. To me, it should be the cornerstone of therapy for chronic Lyme disease, but also a lot of other conditions too. So there's a little information if you are looking to find me, if this is interesting to you. And I guess that it's about 30 minutes. That got us about right, didn't it, Noah?
Yeah, that was perfect, Dr. Rawls. What I wanted to go ahead and open up to the audience so far is a Q&A session. I see there's already a couple of questions in our Q&A box down here, but feel free to add in any more, and Dr. Rawls will speak to them as best he can. So I'll just go ahead and jump right into it. The first is from Joan. She was asking, do you think the Borrelia bacteria lies dormant in the dorsal ganglia like the herpes virus and EBV?
What I'm finding is it's mainly in the cytoplasm of various kinds of cells. That is a possibility. Now, it's a different mechanism with viruses, so you do see it in parts of a cell like the basal ganglion. I don't think Borrelia is hanging out there, but I think it's different for different microbes, and that's one of the fascinating parts is, when we look at this intracellular relationship, different microbes are invading different cells in the body. Borrelia has a preference for cartilage-producing cells, chondrocytes, and also muscle cells, because it likes collagen and it scavenges myelin off of nerve sheets. We know that that is something, so we often see symptoms of MS. Whereas a bacteria like Bartonella has a preference for hanging out inside endothelial cells that line our blood vessels. And Babesia tends to hang out in the liver and spleen, but is also vascular. So different microbes are showing up different places. And that helps explain why one person might have one set of symptoms and another person might have another set of symptoms. I hope that answers the question. I didn't go super deep because it's like there's just so much scientific literature. It's hard to do a really in-depth analysis in a venue like this.
Well, we also have several other questions coming in, so I think that was a great response to that one. Joan also submitted another question during the uh, presentation, which was saying that Borrelia has been identified as affecting joint transplants, which obviously we know that already, but do you think that that would apply to dental implants as well?
Don't know about the implants. I mean, I can talk to things that I've been able to find evidence for. Um, I do know that when you look at root canals and potentially implants too, that can be a source of just bacteria forming around the root or forming in a root canal that can cause someone that can stop someone's progress because the bacteria are constantly seeding. But Borrelia keeps showing up in crazy places. I mean, it's been found inside breast cancer cells. It's been found in all kinds of different places in the body. So it's yeah. But again, I always caution people. I don't think chronic Lyme disease is ever just Borrelia or even the co-infections that we're testing for. I think it's reactivation of a whole lot more than that.
Well, and I think this is a good note for us as an organization is I know there's some holistic dentists that we have within our provider search that do specifically treat tick-borne disease in dental patients. So it could be interesting to maybe get one of them on a future webinar. I don't think I've ever interviewed a holistic dentist before. So they might, to your point, Dr. Rawls, be the better person to answer how it impacts dental implants.
Yeah, I think that would be really interesting too. But the other side of that, what I find is what I found in my own experience and working with, thousands of patients at this point is if you're taking herbs continually, I mean, I've been taking herbs now for 15 years and I just don't have any of the issues that I thought I would be having at this point in my life. It's really startling in a lot of ways. And so taking herbs, an ongoing thing, not just for treatment. I think we have this idea that, we're all in this game of you test and then you find out what's causing the problem and then you treat it and then you test again. And that's not how Lyme disease works. That's not how chronic Lyme disease works. It's not how chronic illness works. And though that model is something that is pretty much archaic in a lot of ways, we need to move beyond that and recognize that this relationship that we have with our microbes in our body is much more complex than we've been assuming over the past 30 years. We all have a dormant tissue and blood microbiome. Some people may be at more risk with certain microbes than others, but it's there with all of this. And as we age, as we become stressed, this reactivation, I think, is the cornerstone for all of chronic illnesses. And so when you look at what the herbs do, herbs are something that you can do ongoing for your entire life. Again, I've been taking herbs for 15 years or more, and it's this ongoing suppression. If you need dental implants and other kinds of things, that kind of ongoing suppression has the potential to keep you out of trouble.
Well, I think this is a perfect segue to our next question from Justin, which asks, are there any specific herbs that are best for Bartonella, or are they basically the same ones that you would typically prescribe for Lyme disease?
Yeah, I mean, I think whether somebody tests positive or not, you really have to provide coverage, a wide range of coverage. So you have to think differently than you have been trained with conventional therapy. So we look at antibiotics as very targeted therapy that have very, very specific purposes, because an antibiotic is a single chemical agent that attacks a bacteria or a protozoa or whatever in one particular way. Where when you're taking an herb, basically what you're doing is you're borrowing the plant's entire defense system. So plants don't have a cellular defense system like our immune system. They have a chemical defense system. So every plant is producing a wide range of antimicrobial substances. All plants, all herbs have antimicrobial properties, every single one of them. You find that some herbs have better antimicrobial properties, though, because it really depends on the microbe stress and other stresses in the plant's native environment. There's a lot of microbe stress. It's going to be producing a wider range and higher concentration of phytochemistry against a wider range of microbes. But it's not one chemical, it's hundreds of chemicals. And there's a certain intelligence about it. So you do have this wide range of coverage. Now, coming out of that, so what studies are showing us is that some herbs are a little better for some things. But it was interesting in the slide I had up just a minute ago, for Bartonella, Japanese knotweed, Chinese skullcap, some of our main Borrelia herbs are really quite good for Bartonella. Now, if people know they have that, I typically recommend adding Cryptolepis, which is another antimicrobial herb. But yeah, you get really pretty good coverage. So when I go into a situation, I'm less reliant on testing than most physicians. I've seen many, many people who have had almost no testing at all, only enough testing to define that they have chronic Lyme, do quite well with herbs, not knowing what they have. And it's but the deal is we test for what we know, right? So 50 years ago, we had no idea that there was Borrelia and that Lyme disease existed. Well, I can tell you, my grandfather had chronic Lyme disease. He was a trapper growing up in the early 1900s, and he hunted and fished all his life. By the time I knew him, when he was in his 40s, he was a wreck. He was disabled. He lived to be 76. He died in 1976, right about the time when we were just finding out about Lyme disease. Looking back, I'm going, he had chronic Lyme disease. There's no doubt about it. And they had nothing, they had no idea of what to do with it. When I wrote my book Unlocking Lyme in 2017, there were 12 species of Borrelia that had been identified that could cause Lyme disease worldwide. We're up to 21 species now. And 20 years ago, nobody was talking about co-infections. Now everybody's talking about co-infections. They tested one species of tick and found that it carried over 237 different families of bacteria. It's hundreds of bacteria. And we don't know what most of them do. So there are going to be other things that we're going to discover. And that's going to happen every year, every month. We're going to find more and more and more new things that people have. Those things have been there. We just didn't have a test for them or didn't know to test for them. So the value of the herbs is they're covering for all that right now. And if you use a broad spectrum of herbs, typically I'll put somebody on typically about a dozen different herbs covering a lot of aspects of potential problems that they can have. But knowing that those herbs have adaptogenic properties, cell protective properties, immune modulating properties, so they're doing a lot more than just suppressing the potential pathogens. So it really gives you a window into helping patients, even though we are ignorant about some things.
I think that you talking about more research and things coming out and learning more every day is a great segue to a question from Jane here, which I'm going to briefly respond to, and then I'll let you talk about it as well. She's stating, how do we find reliable sources for herbs? So what I'll say is that first off, this recording is going to be sent around to everybody who signed up for the event this evening. And in addition to the recording, I will also be sharing Dr. Rawls's presentation and PowerPoint, which include on some of the slides, which are actually some of the last slides that we reviewed before we opened to the Q&A session, directed published journal articles on the use of these herbs for their specific properties and actually in treatment of tick-borne disease. So you'll have reliable sources directly within the PowerPoint that's going to be sent, and then you can go and read more about them. I see here, like, for example, he included some Johns Hopkins research with Dr. Zhang, who's a very well-respected herbalist. So there's a lot of things that exist here that are going to back up the usability and reliability of herbs. So I'll let Dr. Rawls expand a little bit more, but I will share the PowerPoint afterwards.
Yeah, it does matter getting a high enough concentration of the chemicals that we call phytochemicals in the herb. And so part of that is the preparation. Part of that is the steps that the company producing the product go to ensure the quality. So there are three main ways that you can get herbs commercially, and commercial is really the only practical way to do this thing, I think. So the first is a whole herb powder. And basically what they do is they take the plant, dry it, crush it up into a powder, and put it in a capsule. And that's what you're going to find in most health food stores and in a wide range of products. What you're getting in that, though, is mostly fiber, a very, very low concentration of the actual chemicals. So one step up from that, and something that a lot of folks use, I use them myself, are tinctures. So with a tincture, we take the plant, put it in water and alcohol, and the water and alcohol pulls the chemistry, the full chemistry out of the plant. So the water and the alcohol are getting the aqueous and fat-based chemicals and pulling them out. And then they discard the plant part, so there's no fiber. Depending on how much plant they put per water and alcohol depends on the concentration. So something that's really concentrated, you're getting a fair amount of phytochemistry in a tincture. So tinctures are really nice. Some people don't like them because they're bitter, because they have alcohol. You can get glycerite tinctures that don't have alcohol, but they don't seem to be as potent to me. I just never have found them to be as valuable. Not to say they're not useful, but I don't think they're quite as potent. So that's a really reliable way. There are good companies out there that produce tinctures. One step up from that, though, is what we call a standardized extract. And that's what we use in our products. So if you look at a capsule of powdered standardized extract, it looks just like the whole herb extract, but it's quite a bit different. So what a standardized extract is they take the water alcohol tincture, spray it on a surface, dry off the water and alcohol, collect that powder, which is just pure chemicals from the herb, and put that in a capsule. So that's typically 10 times more concentrated than a whole herb powder, which most products. So if you're buying herbs on Amazon, you're mostly getting whole herb powders, and I don't care what the marketing says and all the science and all the stuff they put there. If you look on and it doesn't say standardized extract with X milligram quantity, then you're really not getting very much. So I don't tend to use those kinds of products. I either use tinctures or the powdered extracts. And my favorite for really helping people out is the standardized extracts, because you can get a lot of phytochemistry in someone and a fairly concentrated dose. It's like one capsule is like a half a bottle of a tincture. So it's a lot. And that is the most reliable way I found to really help people. What we do at our company to ensure quality is testing. So when we acquire an extract from a supplier, we always require a certificate of analysis. And what that is they have sent a sample from that lot to a third party, and they've tested it to make sure it's the right species, has the right concentration of chemicals, key chemicals we're looking for, doesn't have bacteria, heavy metals, etc. But we take one step further. We take our own sample from that lot and send it to an independent lab just to verify that the COA was accurate. And then we test during the manufacturing process too. So not all companies do that. I would say a third to a half of companies do, but that testing is really important to ensure that you're really getting something that is good.
So I think this will be the last question for the evening. It'll be a really good wrap up of everything we've discussed so far. How do you approach treating chronic Lyme patients with herbs who also have autoimmune conditions? And would you still use immune modulating herbs?
Oh, absolutely. No doubt about it. What you wouldn't use, though, is herbs that are immune stimulants. So herbs like echinacea and elderberry, which are commonly used for acute viral infections, are immune stimulants, and that's not what you want. All the herbs that I've mentioned are immune modulating herbs, and what that means is they tone down overactive portions of the immune system, like the immune system attacking our tissues, and also they bump up less active. And the microbes are actually manipulating the system. This idea that they can invade cells is really important. They invade all of our immune cells, and this has been documented for virtually all the pathogens we're talking about, that they invade immune cells and they can manipulate the cytokines, the chemical messengers of the immune system, to throw the immune system off guard. This is a common survival mechanism. They also use it as what's called a Trojan horse mechanism, and this has been documented for Borrelia, Bartonella, SARS from COVID, virtually everything, that the microbes invade the white blood cells and they use that as a vehicle to be carried across the blood-brain barrier into the brain. So that's one mechanism. But think about this. I've described this situation where we all have dormant microbes, and then we do things like, for me, it was 20 years of not getting sleep and poor diet and pushing that stress button over and over and over again. And we end up with widespread cellular stress throughout our body, and these microbes start emerging from various tissues. They emerge and start attacking other cells. So they emerge where cells are the weakest, which explains some of that migrating arthritis that everybody gets and migrating symptoms. It's kind of like the immune system puts out a fire in one place and goes to another place. But think about that. So when that starts happening, you've got microbes that are emerging from cells throughout the body. The immune system sees this and goes, oh no, we can't have this. And it starts attacking the cells where the microbes are emerging from. And that, to me, provides the most plausible explanation for what's going on with autoimmunity. And this idea that we have a dormant microbe, I think we all have reactivation going on all the time, just at a very low level. I use the analogy of a pot on the stove. So we're a pot of water on the stove, and if we've got a little heat, we're at a simmer, but we don't feel symptoms. So we've all got a little bit of microbe reactivation, and you put some more heat in there in form of cellular stress, and you get to a level where you start feeling some joint pain and you start having some fatigue, and it keeps going until you're at a full boil, and then your whole body is reacting, microbes are reacting and changing your body into a food supply, basically. So I think that's what's going on with virtually every chronic illness. So there's some evidence of that, and the biggest one is looking at our indicators for autoimmunity. So when you look at a test like an ANA, the normal test is not 0. The normal test is a range, which means everyone has some autoimmunity going on in their body all of the time. Everybody at a certain level. It's only when it gets a high level that we define it as an autoimmune illness. And I've had plenty of people treated with herbs that had a positive ANA that once they were treated, it came back down. So we're not only treating the source of the problem by suppressing these reactivation of microbes, we're balancing the immune system. So that arbitrary number that we set as defining someone with autoimmunity, I think a big part of what's driving that is the toxicities of the therapies for autoimmune illnesses are very, very toxic. So we don't want people with a lower ANA being defined as autoimmune and being exposed to these really, really toxic drugs. So that's a different way. So in a way, the definition of autoimmunity is set by the toxicity of the drugs. It's an arbitrary number.
That's very interesting. I hope we were able to answer that question for you. I know it was submitted by an anonymous attendee, so no name there. But I wanted to first off say thank you, Dr. Rawls, so much for presenting this evening. Thank you, everybody, for attending. We will likely have Dr. Rawls on again sometime in the near future to continue this discussion. As I said, I will be sending around his PowerPoint from this evening. I will be sending around the recording, so you'll get an opportunity to watch it again. And if you did not get some of your questions answered, Dr. Rawls, will I be able to share your contact information too, or how would you like me to go about that? Because I don't want to have you have an influx of emails.
Well, the easiest way to get me is probably either thevitalplan.com or therawlsmd.com. And it's pretty easy to find me. And, I am always interested in getting involved in conversations. I encourage people to do that. But we have a lot going on. We're in the process of building a community that gives me a way to distribute all this knowledge that I've accumulated over time and through courses, through live streams, through seminars. So we have a lot going on, and we encourage people to join us and join the conversation.
I will make sure to link your Rawls MD website as a part of the email I send out tomorrow, just so people can find more information about you and your work there. Thank you again, Dr. Rawls, for your conversation this evening. I think it was very informative. And again, thank you all participants for joining us. Everybody have a great rest of your night.
All right. Thank you
Thanks.
very much.
Bye-bye.
Appreciate it, Noah.